Hi everyone, we're in section 9.3 and I'm going to call this part 1 right now. I think I'm going to end up doing this in 2 parts just to make the videos not too long. And so if you're following along on your learning outcomes for section 9.3, what I did is I wrote them out and underlined them at the top of the pages so you can find these learning outcomes on your lecture study guide. And so the first one is name the desirable characteristics of chemical control agents. So we finished talking about physical control agents, and now we're on to chemicals. And when you're looking for a chemical, look around your house, you've got all sorts of chemicals that you use for microbial control. And these are some of the things that we're looking for in them. There's lots more chemicals that will kill microbes, but they're not all appropriate for using in the situations where we like to use them. So the first bullet here says they need rapid action even in low concentrations. And all these are written out in your book. And so, we want to spray something and then wipe it up. We don't want to have to wait a really long time. They need to be soluble in water or alcohol and have long-term stability. These are products that we're going to have sitting around, and we want to be able to use them. We don't want to have to mix them up and things like that. Broad spectrum microbicidal activity. Broad spectrum microbicidal action without being toxic to human and animal tissues. Now, all of these will have some level of toxicity, but they have to have very low toxicity because they're going to be used in situations where there are living organisms that you don't want to kill. Resistance to becoming inactivated by organic matter. A lot of times when we're trying to kill microorganisms, we're also removing dirt. Or in a clinical setting, you might be wiping out blood. And so to have a lot of organic matter around is a natural thing. So to be resistant to being inactivated in the presence of organic matter would be an important characteristic for a chemical control agent. We don't want them to be corrosive or staining. A lot of times when I go to use bleach, I think, I could use bleach to control microbes there, but it would bleach. It would remove the color from the substance that I'm trying to treat, so you might not use it. So you don't want it to degrade the surfaces that you're treating. And finally, they need to be affordable and available. Okay, here we are on the next learning outcome. Distinguish among high, intermediate, and low-level germicides. Give examples in a medical setting. And I think when we get to the end of this, you'll have all sorts of examples. And I'm not going to necessarily quiz you on all the, is this a high level or high, intermediate, or low level germicide? But I think you should be aware of the concepts. And in particular, high levels would be important to know or to recognize. Germicides are evaluated in terms of their effectiveness in destroying microbes in medical and dental settings. So if we classify something as a high-level germicide, it's going to inactivate endospores. And remember, that's our standard for being able to sterilize. So high-level germicides are those that sterilize. That being said, when we're trying to sterilize things, quite often we'll go to the physical control methods. We'll heat things or we'll use radiation, things like that. Chemicals are used less frequently for sterilizing, but there are some important ones that can be used for sterilizing. Intermediate level germicides are going to kill fungal spores, but not bacterial spores. And some of the resistant pathogens. The first one that comes to mind is Mycobacterium, the one that causes tuberculosis. And some viruses are more resistant. So these intermediate levels are going to be able to do that. And then the low-level germicides are going to primarily kill just the vegetative bacteria and fungal cell and the remaining viruses. These are, a lot of the things that we would use around the house. We do have some higher level ones around the house, but most of them are kind of at this level. So if you look in section 9.3, there's this great big table that covers a couple pages. And what I did is I took the sections out of the table and I talk about them separately rather than just standing there staring at this big long table while I'm talking. So I wanted to put some pictures there and remind myself of some things I'd like you to know about these. You don't necessarily need to know all the information in the table. And I'm going to kind of cite the things that I think are important for you to know. So what we're going to do in the rest of this lecture is go through all sorts of chemical agents. And I'm trying to think of things that you should know about them and highlighting them. So the first thing I wanted to mention is I'm just going to do this. And its use, discuss chlorine and its use for microbial control. I think in the notes I have chlorine and iodine grouped together because they're both halogens. You might remember halogens are that group 7. It's all the way second from the right on the periodic table, the column there. Chlorine, iodine, bromine, things like that are halogens. And chlorine and iodine in particular, we use for microbial control. Bromine in some cases is also used. One of the things we want to keep an eye on, though, is can they kill endospores? Now here it says chlorine can kill endospores, meaning it can sterilize, but it does it slowly. So it would only be used to kill endospores under certain circumstances. We would only expect it to sterilize under highly controlled circumstances. The chlorine that we use quite often, here it says these hypochlorites, chloramines. One of the really common forms that we use chlorine for microbial control is from Clorox, from bleach, and that's called hypochlorous acid, or you might hear in the form of sodium hypochlorite. And so this is a really common source of chlorine that we use in all sorts of situations. It's probably the most common agent that's can sterilize that you would use at home. The one thing about using chlorine is it can be used, we use it as a liquid, and typically we're using it as a disinfectant in those cases. But it also can be used in the form of a gas. So chlorine can be used in the form of a liquid, or it can be used in the form of a gas. 10% bleach can actually sterilize, and it just depends on what microbes you're trying to treat and what surfaces to determine how long that is. But 10% bleach, one part bleach, 9 parts water, you can use to sterilize. And the kinds of things that we use chlorine for killing microbes, tells you it kills all the microbes, starting with endospores. We use it to disinfect drinking water. Now, we don't have 10% bleach in our drinking water. It wouldn't taste good. It might not be safe to drink it at that high, but it substantially reduces the number of microbes in there. Water that's been treated before it's released into rivers, like it's been treated in a sewage treatment plant, quite often is treated with chlorine to reduce the number of microbes. It's used in healthcare to treat wounds. I don't hear a lot in healthcare, in human healthcare, about using chlorine to treat wounds, but I must say I did go to a vet one time, and my dog had been hit by a car, and the vet was getting ready to close, and the dog had brush burns all over its side, and they said make a 5% bleach solution and use as an antiseptic to clean out the wounds. And so you can do that. It can be used to disinfect bedding, instruments, sanitize food, food equipment, pools, spas, that kind of thing. So chlorine is used extensively. It's really important. The one thing here, it says it can be used as a gas to sterilize. This would only be used in exceptional cases. I heard of the situation in 2009, I think, where anthrax was sent through the mail to a couple different buildings, and they tented buildings, and meaning they kind of covered them with plastic sections of the building at a time, and they pumped chlorine gas through the buildings. Now that would be deadly if a person was in there, but it can be used in a highly controlled case to kill anthrax endospores. So it can be useful in extreme cases like that. The other halogen I wanted to talk about was iodine. So discuss iodine and its use for microbial control. And like I said, it's a halogen. It's related to chlorine. It also can kill endospores. And it says it's used as free iodine in solution, but there's also some chemicals that are iodine and some organic molecules that are called iodophores. So we use iodine in all sorts of ways. And a couple of the ways that you see here, here's a patient getting ready to go through surgery, and they're swabbing their skin with probably betadine, which contains iodine as the active ingredient. And one of the nice things about iodine is right here. It says 2 to 10% of these products are available with 2 to 10% iodine. And the nice thing about it is the iodine is released slowly. So what you can do is you can swab the skin before surgery, and then during the surgery, when there's an open incision, the betadine continues to kill the microorganisms. It can also be used in surgical scrubs to treat burns, for disinfectants, but probably this is one of the most common ways. Oh, also you've probably seen, if you've ever donated blood, is they give you a little swab on your arm before they put the needle in. And so the needle's sitting there for, the next 20 minutes or so, and microbes continue to be killed on your skin. It can be irritating and toxic, and some people are actually allergic to iodine. But it's actually a very useful antimicrobial, mostly used as an antiseptic. Here's another common antiseptic, and in some cases it can be used in place of betadine. Might have used betadine previously, but it's a chemical called chlorhexidine. And chlorhexidine, it says, kills most bacteria and viruses and fungi. So it's not a high level germicide. It's going to be more of an intermediate, or it says most bacteria. So it's an intermediate or low depending on the concentration and how it's used. And so this chlorhexidine actually does contain some chlorine and some phenol, another antimicrobial, but this is a certain chemical mixture of that. And when would you use these? Well, one of the most common ways that we're using chlorhexidine today is before a patient gets surgery. It says prepping for surgery. It can be used in hand scrubs for surgeons getting ready for the surgery, but the patient might also be sent home with chlorhexidine wipes. And so what they do is they tell the patient how to clean their body with these wipes before they do the surgery. And a lot of times you'll do the body cleaning the night before the surgery and then the day of the surgery. And it's just trying to reduce the number of microorganisms on the skin. It's not going to sterilize, but it's going to give a substantial reduction and hopefully reduce the chance of getting infections in the skin. And so effects on viruses and fungi are variable, but in the case where these are used, they're most commonly used to kill bacteria, to prevent it from getting into wounds. Here's one from a pet supply company. So even in dogs and cats, you might use chlorhexidine wipes. I know a lot of breeds that have those wrinkles, like bulldogs, can get skin infections. So you might use those to wipe out those skin infections. This would be something that you would use on the surface of the skin, not inside the skin. There actually are chlorhexidine rinses that you would use in the mouth. So you can even use mucous membranes can be rinsed with chlorhexidine, but not inside the body. Explain the common uses of hydrogen peroxide for microbial control. Now, this is one of those compounds we have at home, and we use it for an antiseptic. And it says hydrogen peroxide can kill endospores, which means it can sterilize, but it's not typically used that way. Typical, if you could see this a little bit larger, hydrogen peroxide is typically used as a 3% solution, and that's enough to use as an antiseptic, not typically enough to use to sterilize. So I would consider this, at this concentration, a low-level germicide. but hydrogen peroxide works quite well in killing bacteria, and it says as an antiseptic it's used at about 3%. It can be used on skin or wound or even mouthwashing. I know my dentist during COVID had us rinse with hydrogen peroxide before getting work done to reduce the potential virus in your mouth. Bed sores might be cleaned with hydrogen peroxide. That being said, we do know that hydrogen peroxide can slow wound healing. And so if it's a sore, like a bed sore that's having a hard time healing, you might consider using a different antiseptic than hydrogen peroxide. At home, most of your sores and things are not that serious, so hydrogen peroxide can be very effective. Here it says in a 35% solution, that's pretty high, it can be used to sterilize instruments that might be used in surgical settings. Sporicidal only in high concentrations. So this would be something that would be used in a professional setting, not in a home care or wound care setting. I put this here to remind you about that our cells, bacterial cells and our cells, a lot of times contain catalase, and catalase breaks down hydrogen peroxide. And so I put a question in your handout that said, why would hydrogen peroxide work better on an inanimate object than in living tissue? Is because living tissue usually contains catalase and breaks it down. Hydrogen peroxide can be used, like here it says, on inanimate objects. And even in the food industry, you might use hydrogen peroxide to wipe off a tabletop, and catalase would not be present to inactivate it. I'm going to stop right there and go on to the next part in the next video.